Congressman, the microphone is yours.
Well, thank you, Congressman. And I wanted to add, I was hoping to serve with you. I actually ran for U.S. Congress 2 years ago in a special election and came up short, but I ran on a universal single-payer healthcare platform. So it's great to be here.
It could be twice. I recommend trying it.
Well, good afternoon, and thank you very much, and thank you, Congressman Massa, for the introduction. My name is James Eldridge. I'm State Senator for the Middlesex and Worcester District in the Commonwealth of Massachusetts. And I want to thank in particular MassCare for reaching out to me to be here to testify about Massachusetts healthcare reform and the Massachusetts law that I was a participant in. I am absolutely committed to working with healthcare advocates, my Massachusetts colleagues, and folks like those on this panel to working towards true universal single-payer healthcare. And I'm a proud co-sponsor of the Universal Healthcare Bill in the Commonwealth of Massachusetts that's been filed this session. I'm here today as a member of the Massachusetts State Legislature, someone who supported and voted for the Massachusetts healthcare law of 2006, and someone who witnessed the effect the law has had on my constituents and people throughout the Commonwealth. And I wanted to come today to talk about some of the benefits of the law, but some of the drawbacks, and the process that legislators and organizations went through in passing this legislation in order for congresspersons to perhaps learn a lesson and information about, in creating a national health insurance program, what steps not to take in terms of getting to that goal. The first is that the law has had one very significant positive outcome. A lot more people now have health insurance. As of June 2008, an additional 440,000 people in the Commonwealth of Massachusetts now have health care coverage, which means approximately 2/3 of the people who were previously uninsured now have coverage. And according to the U.S. Census, the percentage of uninsured in Massachusetts, as a result, has been cut in half to an estimated 5.4%. So although the reform has not gotten us to universal health care reform, it is clear that it's led to a significant increase in the number of people who are informed, and that's very good news. Equally important, I think, though, in Massachusetts, the health care reform law really shifted the conversation, putting the goal of universal health care access front and center. Whereas in the past we were always talking about incremental reductions in the number of the uninsured, now the rallying cry is reaching that true universal goal. Those are the upsides to the law. The downsides, however, are extensive and troubling. And once you've taken a hard look at the numbers and the systematic effects of the law, I think you'll see that the law on the whole has not been nearly as much of a success as conventional wisdom suggests. The reality is that if our goal is universal health care coverage and universal access to health care in this country, the Massachusetts model will not get us there. It is my belief, as someone who's experienced the law up close and personal, that the Massachusetts model should not be adopted for the nation. One of the biggest failures of the healthcare reform law has been cost control. Now, I know the other presenters have already talked about the problem of healthcare costs. I'm not going to go into too many details, but I just want to outline a few areas that are troublesome. First is the cost to the Commonwealth. The assumption was that as more people, particularly young and relatively healthy people, joined the system, premiums would go down across the board. There was also the assumption that as more people became insured, the number of people going to the emergency room would drop dramatically, saving the Commonwealth money because the form of care is often so much more expensive. Neither of those things have happened in Massachusetts, at least not enough to produce the cost savings that we were told we would see. In fact, healthcare reform has cost the Commonwealth much more than expected, upwards of $1.3 billion additional this year. Now, I don't have to tell anyone here that at a time when state governments across the country are slashing direct services for the poor and the mentally ill, it is maddening that so much of our public health care dollars go to HMOs and health insurance companies under the current employer-based Massachusetts healthcare system. Secondly, the greater cost to consumers. The cost of healthcare has risen rather than fallen for most consumers. And despite the initial hopes, healthcare is not becoming more affordable for most people. There are many people caught in the numerous gaps of the system who have seen the overall amount they spend on healthcare rise dramatically. Premium rates continue to rise for most people, and low-income patients who under the old system received completely free care are now facing co-payments and premiums that stop them from even going to the doctors. In addition, we're seeing that although many more people have health insurance coverage now, that doesn't mean they have a greater ability to access health care. The ranks of the underinsured are growing, and many of the patients on the new health care plans are finding the services they used to be able to access freely are now restricted. For example, mental health clinics across the Commonwealth now often have to turn patients away because they've used up the limited number of psychiatric visits covered under many of these plans. That is unacceptable. When looking at the effects of the Massachusetts health care law, I think we need to remember that our goal isn't simply to have everyone insured, but rather to have everyone able to access the health care they need. And finally, the healthcare law provides no help for small businesses. A big hope for healthcare reform in Massachusetts was that as the cost of healthcare went down, small businesses would have an easier time insuring their workers. Healthcare costs have gone up, not down, however, which means the law has provided no relief to small businesses that would like to insure their workers but can't afford to. So how do we get there? As a legislator for the past 6 years, I had the opportunity to closely observe the process the legislature went through to create the healthcare reform bill. And I'm of the opinion that many flaws of the process led to the many flaws in the legislation. The first was the major impetus for creating the healthcare reform, which Dr. Himmelstein mentioned. This legislation came from the actions of the Bush administration, which insisted that Massachusetts reduce the block funding of indigent care through our free care pool, or forfeit $385 million in federal Medicaid funds. This had both positive and negative effects. Because there was a deadline attached, we got something done. But it also meant that the process was driven almost entirely by the need to keep those federal dollars in Massachusetts, instead of a broader discussion about what universal health care as state legislation should really look like. It also meant that the initial focus was on reducing the number of people getting free care, rather than on improving health care access for all. This was enforced by local media coverage, which focused on health care as an individual rather than a collective responsibility. A single-payer system, or any notion that health care is a basic human right, was taken off the table, thus limiting the options for expanding access from the very start. A debate that could have started comparing health care as a right, just like public education, instead allowed a Republican governor preparing to run for president to trumpet the deeply cynical notion of personal responsibility as a component of health care reform. Giving certain special interest groups a seat at the table also greatly hurt the efforts to include several key elements to the bill. For example, because health insurance companies had such a large voice in credit. Third is the fact that the Massachusetts healthcare discussion never strayed from the notion of being employer-based, which meant it was very easy for the big business community to attack plans to fund a more universal healthcare model. When proposals came up to increase that amount that employers who did not provide health insurance had to pay, they were immediately squelched by those business leaders. As a result, the penalty to companies that don't provide insurance is a minuscule $295 per employee, far, far less than it costs to provide health care to a worker. This mindset kept the media focused on the notion that health care was a mere employee benefit as opposed to a basic human right. As Congress turns its attention to health care reform, I urge you to consider the lessons we've learned in Massachusetts, particularly when it comes to the process involved in creating the reform and which groups have that all-important seat at the table. As someone who has long advocated for universal health care, I had hoped the Massachusetts model would prove to be a success, even as I had concerns about the process. But after observing the effects that the law has had, I strongly urge you not to adopt the Massachusetts model on a national scale. Thank you.